I wanted to let you know that here we are in the middle of this pandemic. I've been grateful for the hard work that you are doing. Know that getting vaccines across North Carolina into arms is the #1 priority right now. And I want to tell you about something that is about to happen today. We're going to be opening up the criteria for people 65 and over. So not only people 75 and over will be able to get a COVID-19 vaccine now, but those 65 and over will be, along with healthcare providers. And I know that your health departments and hospitals in your area are working hard, but there are a couple of things that I would like you to do as elected leaders. First, encourage your health departments to use all the supply that has been allotted to them. A lot of counties have the problem, well, we've already used up what you've given us and we need more. And that's what we want to hear, because we want to get you more just as soon as we get an allotment from the federal government. But a number of counties have not yet been able to get out allocations that they have. And I'd like for you as elected leaders to make that an absolute priority, to encourage your health directors to get it done. Also, we are encouraging appointments. And it's also very important that they enter the data into our system to make sure whenever they've given a vaccine that we know about it, because that, we're going to use that information in basing on future allotments. So know that. Secondly, some of your health departments are overworked, understaffed. I know that many of them have worked so hard over the last 10 months. It has been a grueling period. But we are asking all counties for whatever help that you need, whether it's technology, whether it's logistics, answering the phones, appointments, emergency. I've activated our emergency management. Mr. Sprayberry and team have called all of your emergency management operations. And we'd like for you all to make sure that your local emergency management are providing help to local health departments if local health departments request it. And we're also trying to send state help your way. And we've continued to ask health departments and hospitals to ask us for the help. I've mobilized the National Guard to help with this. We are using some of the people who are in contact tracing who are helping with this. So getting these vaccines out are critical. We're also bringing in private companies and working on high throughput sites. So push your health directors to ask for help if they need it so that we can get this done. We also know that the next few months are going to be tough. Regardless of how many people we vaccinate, we know that we will not be able to get the acquired immunity for several months. So our prevention efforts are more important than ever. I ask you all to set examples about wearing masks and social distancing. Many people have become to realize that there are friends and family members and neighbors and people that they know who have gotten really sick or seriously ill. And the insidious thing about this virus is about half the people can get it and never know it. And those are the ones who really can spread this disease, and why it's so important for everybody to wear a mask. Most of your counties are red or orange. And the way we are telling people, assume people that you meet have COVID. And so that can show that you mask and social distance and do the things that you need. And obviously we would like your help with enforcement. Local governments can pass ordinances that allow some of your employees to enforce safety protocols that we have in place. And so we ask your sheriffs and others to help us with this, because we can save lives. We've got almost 100 people a day dying in North Carolina from COVID. We're about to hit the 8,000 mark. And we know that our hospitals are getting more and more full of people, and ICU beds are getting full. So we owe it to people to let's get through these next few months, get people vaccinated, and let's turn the corner to get out of this.